Hello, everyone. Welcome to Coffee with Marci. Thank you for joining us. Are you coming on? I'm going to wait just a minute and let you guys join us. Thank you for joining Dr. Denoble. This is Dr. Shagha Denoble. She is my gynecologist. And I want to make sure, Advanced Gynecology and Laparoscopy of New Jersey. So I'm going to see, sometimes it doesn't work.
Oh, there's somebody.
Initially. Patrick. Oh, okay. All right. Hello. I'm so glad you guys are here. I'm here with my gynecologist, Dr. Shagha Denoble. And she has been asked some questions since the last show. And so we're going to talk about those things. So the first thing that I want to talk about is irregular bleeding patterns. Once we women hit 40 and perimenopause and our bleeding changes. So can you tell us about that? Why does that happen?
Well, first of all, thank you again for having me.
Of course,
I had
it's
a
so
lovely
great.
time last month.
Yes.
And thank you all for tuning in to watch. And I enjoyed your comments from the last session. So I'm very happy to be back to speak to you all. One common concern that I hear a lot of in my office when women come in their early 40s, mid 40s, they do complain, patients complain of their periods changing. And they're not sure what's going on.
Yes.
So just to review briefly, average age, the median age of menopause in this country is 51. So that is, menopause is when you have not had a period in 12 months.
Okay.
And there isn't any other cause of it. There's nothing structural or any other major problem occurring.
Right.
Then we say someone is in menopause.
Yes.
And any bleeding after that definitely has to be addressed.
Okay.
Has to be evaluated because you want to make sure it's not anything worrisome like endometrial cancer or uterine cancer.
And what kind of bleeding would that be? Would it be spotting? Would it be,
A lot of times it's just a couple days of spotting. It's not anything significant.
Okay.
So sometimes women ignore it. And then like a year later, they're bleeding heavier, so they finally address it with their doctors. And the good thing about endometrial cancer is that it does have an early sign, which is some spotting after menopause.
Good.
And it's usually diagnosed very early because of that.
Okay.
But you don't want to ignore it because if it is endometrial cancer, later stages definitely change the prognosis.
So if you've hit menopause, it's not normal to have any bleeding.
Correct.
Okay, so if you have bleeding, then you should have that checked.
Yes, see your doctor. Now, a lot of the times, majority of the time when there is bleeding, it's not cancer. So I don't want women to freak out that, oh my gosh, I have cancer.
It's
but
important
it has
to
to be ruled
listen
out.
to your body and
it has to be ruled out. So average age, as I mentioned, is 51. On average, 4 years before that, there are a lot of changes in your periods. It's called the perimenopause or the transition. And that can be up to 10 years before you hit menopause.
I was going to ask you. I've heard 10 years because I feel like I've been dealing with it for quite some time.
Absolutely.
I'm not telling my age though.
You're way far from that age.
No.
So one of the things we see as a result of declining fertility, your menstrual cycles, the progesterone levels in your menstrual cycles are lower. So usually you want progesterone and estrogen to be in balance, and that keeps the periods regular. It keeps the lining of the uterus regular and thin with the shedding, so you don't form abnormalities there in the cavity of the uterus. But the progesterone levels do go down as the quality of the eggs are diminishing.
Okay.
As your fertility is declining. And when that happens, typically the menstrual cycles are shorter. Usually they're 28 to 35 days long.
Okay.
When you're counting from the first day of one period to the first day of the next period.
Okay.
And they do start to get shorter because the time frame from the first day of your period until you release an egg again becomes a little bit shorter.
Okay.
So women do find, oh, my periods are like, now they're closer together.
Yes.
Sometimes you can have some spotting in between periods.
Yes.
So that can occur, and then as you approach menopause, some months they can be really heavy. You can
Really
start
heavy,
having
and can
periods.
you can skip a month also.
Yes, you can start skipping.
Okay.
You'll skip maybe 3 months,
Right.
and then when you get a period, it's super heavy. It can last a whole month.
Wow.
So a lot of changes occur. A lot of other symptoms occur as well. Sleep disturbance, hot flashes.
Right.
So a lot of other things can occur at the same time.
And I'm
We're
sorry to
gonna focus on
interrupt.
the
Can you?
bleeding. Sure.
Is there a blood test? Is there a way to find out
Yes.
if you
Yes.
are in the throes of perimenopause?
Yes. So
Okay.
one of the hormones we check is called FSH.
Okay.
Follicular stimulating hormone.
Okay.
That starts to go up.
All right.
Okay.
Uh-huh.
And then when you getting closer to your menopause, the estrogen levels are really high.
Okay.
So estrogen kind of feeds the lining of the uterus to grow,
Uh-huh.
so it can become abnormally thickened. And
Okay.
since the progesterone is lower, that's not balancing out the estrogen, so you can get thick linings. When you bleed, it can be really heavy.
Mm-hmm.
As also another thing that can form in the uterine cavity are polyps.
Yes.
So when a patient comes complaining of irregular periods, we don't want to just ignore it and say, you're just in the transition period and we're just going to wait and see. We do want to evaluate to see if there's anything structural, like fibroids that could be causing the bleeding, or polyps.
Okay.
Because you don't want to necessarily ignore those. For example, polyps they're kind of fleshy growths, usually about 1 centimeter, 2 centimeters, that are in the lining of the uterus. A typical ultrasound can pick it up. That you can
So you would have an ultrasound to have that checked.
Because if there is a polyp, you do want to remove it because it can continue causing bleeding issues. Also, you want to make sure there is not a precancer in the polyp.
Right.
Because as I mentioned, the estrogen levels are relatively higher in this transition period, and excess estrogen can sometimes lead to precancer of the uterine lining, which is called hyperplasia, in case you've ever heard that from your doctor.
Okay.
And if you ignore it, some of those can progress to cancer, endometrial cancer.
Which is not common though, right?
Not common.
Not common, but
risk
it can
factors,
happen.
if you have certain risk factors like obesity, high blood pressure, diabetes, that does increase your risk.
Okay.
So you do definitely want to get that checked out. Sometimes you'll need a DNC of the lining of the uterus. If you have irregular bleeding and the ultrasound shows a thickening, you do want to do that to rule out anything else going on. Once all that is ruled out, you can either keep monitoring your periods to see if they get better. But if they're very troublesome, we do have treatments.
So treatments, like what exactly would the treatments be? And can you help the estrogen? Can you change that? Can you level out things in your body? Okay.
You can level things out so you don't have such irregular periods or heavy periods that are really bothersome.
Yeah.
And can really interfere with your daily life. If they're not interfering, you can just watch them. As long as everything else has been ruled out, as I mentioned.
Okay.
So the various treatments we have, sometimes we just start with a low-dose birth control pill.
Okay.
In women, obviously, that is not contraindicated. You don't want to use that if you have blood clots, if you have very high blood pressure. If you've had history of stroke, you obviously don't want to use that.
Okay.
If you've had breast cancer or have breast cancer, you definitely don't want to use estrogen or birth control pills.
Right.
But low-dose birth control pills are a great way.
Okay.
That will regulate your periods. That will help transition you to menopause.
Okay.
Another option, sometimes we don't do combination birth control pills because birth control pills have estrogen and progesterone. Sometimes we use only progesterone. You can take it as a pill every day or half of the month. You can use it as an injection of a progesterone medication. That helps.
Okay. Oh wow. Okay.
Yeah, and that can help get your regular periods and prevent them from being very heavy.
Now, can that help all of the other issues we have? Okay, I know we're focusing on the bleeding, but let's talk about the mood swings, the issues with sleeping, or heat waves.
It can help with hot flashes. It can sometimes help with mood disturbances. It'll kind of regulate your hormones.
I like how nice she says it. Mood disturbances.
Mood disturbances.
That's a really nice way to say it.
Now, hot flashes we mentioned. Up to 80% of women have hot flashes, and that can certainly cause sleep disturbance because it does happen more at nighttime. So if you're having sleep issues around menopause or before menopause, if the hot flashes are contributing, you can treat the hot flashes.
Are the hot flashes what are keeping you awake? Is there
Not
something else going on?
So some women who don't even have hot flashes still have sleep disturbances.
Okay. Yes.
So you want to look into that. That's a complicated issue, sleep issues. Certainly stress can lead to that. Screen time, using your iPhone and your iPad and watching TV, we're finding can affect your sleep. Melatonin levels.
They are talking strongly about that.
Yeah.
But and it's been proven, but I feel like, mothers especially, I'll just talk about mothers, I'm talking about women, that's their time. They get into bed, They're looking at their iPad, they're looking at their phone, they're catching up on things, whatever it may be, whether it's social media or watching my show.
Yeah, absolutely. Absolutely.
It's very important too.
Right.
No, and their emails. So, I mean, it's hard.
But there are, I know, on your iPhones and your iPads, there are now a feature.
Okay.
You can click on that is a night shift. And it reduces the glare. Just it blocks the certain.
So it doesn't think it's daytime, right? Because
So it blocks some of those emissions from your phone or iPad or your tablet that can affect your melatonin. So just check that on your phone. It's easy to find. It's called night shift. You want to put night shift on.
All right.
So
and then exercise and diet.
Yes, diet, exercise, all those things certainly. So there are things you can sometimes take melatonin, and you can try different things to help your sleep. But definitely, if the hot flashes are contributing, you can treat those. There are non-hormonal ways to treat hot flashes. So if you're shying away from hormones for valid reasons, there are other medications available that can help with diminish hot flashes.
And that
some
is
are
that
herbal,
prescribed or
some are prescription? Absolutely. So we can try different things. But also going back to the bleeding patterns. So aside from taking hormones, progesterone or birth control pills, another way you can regulate your periods is placing a progesterone releasing IUD. Called Mirena. One name is Mirena, which is the popular brand. There are new ones coming out. But these are basically T-shaped devices that we implant in the uterine cavity. It's done very easily in the office. And that specific IUD releases progesterone, so it keeps the lining of uterus thin. So it does actually lower your risk of endometrial cancer or the pre-cancer condition. And it will regulate your period. Most women, after having it for 6 months, no longer bleed. So that's another wonderful thing to use until you get to menopause.
Can I just ask you one thing about the IUD? Let's say a woman gets it at 49. And it lasts up to 5 years. 5 years. So now maybe she's not having her period, but she's not sure, is it the IUD or I actually have menopause? Like, how
Great
do you
question.
know?
That's an excellent question, and we can do blood work.
So
again, we would check that FSH that I mentioned and your estrogen levels and see if it looks like you're already completed menopause.
Now, would you keep the IUD in
you can
if
pull
you're
it
in
at
menopause?
Then you can take it out. You can leave it in. It's not going to be harmful to leave it in for the whole 5 years if it's not bothering you. But if you think you want it out, if you're definitely menopause, we can do some blood work and then you can take it out.
All right. Would you need the IUD? Would it help symptoms, or do you know? So there's really no reason to have the foreign object in your body. If you are in menopause.
It does not. The IUD does not help any of the other systemic symptoms like hot flashes and mood changes. It only really helps the bleeding. But it is a wonderful, wonderful option that is a little bit invasive, but not fully invasive like surgery. Because surgical, if you want to discuss surgical options, if you're having heavy bleeding, there is a procedure called an endometrial ablation, which if you're the right candidate, not everyone is a great candidate for it, but if you have a normal sized uterus, normal shape, there aren't any major fibroids or other conditions, it's a surgical outpatient procedure where the doctor or the surgeon would introduce a device into the uterine cavity and burn the lining.
And that's something you do?
Yes, I do that. It is a lot of gynecologists perform that procedure. It's called endometrial ablation. And you're ablating or burning the endometrial layer, that layer of the uterine cavity that does shed. And it will diminish or stop your bleeding altogether. In a third of women, it will greatly reduce the amount of blood loss, so they're happy. Because they just don't want to have heavy bleeding, where they're hemorrhaging, missing work, getting infected. And in a third of women, you will no longer have any more bleeding, or just maybe some light spotting. So
there's that for surgery. There's the polyps.
Yes.
And can you touch on that surgery?
So the procedure to remove your polyps is also a straightforward outpatient surgical procedure. Usually done in the hospital or at a surgical center. Some physicians do perform it in their office. And there's a scope, a camera. It's kind of like a colonoscopy for your uterus in a sense. It's a scope you introduce into the uterine cavity to look at the cavity, and you can introduce instruments through that to take out polyps.
And you do recommend that be done if you have polyps?
If you do have a polyp, would you recommend removing that? Because 2 reasons. One, it can continue causing bleeding issues. It can cause heavy periods or bleeding in between periods or bleeding after intercourse. So you do want to remove it, and you also want to remove it to send it to pathologist and make sure there isn't anything precancerous.
Yes, precancerous.
Because then you would have to treat that.
Yeah. And how about the fibroids? Do you remove those too?
Yes. So fibroids, depending on where they are, can cause bleeding issues.
And I'm sorry, you said where they are. Where all can they be?
So if they're in the cavity of the uterus, they certainly cause bleeding problems. And those can be done in the same way I mentioned for the polyps.
Right.
If the fibroid is majority of it or all of it is in the uterine cavity, it can be removed through the scope.
Okay.
And you go home an hour later after your surgery. It's outpatient surgery.
Wow. Okay.
Fibroids in other locations have to be treated abdominally, depending on where they're located. But you know, vaginally, a lot of things can be done, so you really miss one day of work.
Okay. One of the other things we were talking about is pregnancy.
Yes. Yes.
So tell us about that. What are there issues, or is there anything that we need to do to change that, or to increase our ability to get pregnant?
Good question.
Yeah.
So, you know, we're discussing bleeding issues typically in your 40s, but some women, if you're in your early 40s and you're still trying to get pregnant, but you're having heavy periods, there are medications to help. So obviously, the birth control pill is not going to be useful because it will treat your bleeding, but then you can't get pregnant.
Right.
There is a medication called Listita that greatly reduces your blood loss.
Listita. Okay.
And you only take it during your period.
Oh.
So it's not gonna. You can use that if you're trying to actively get pregnant.
Okay.
You take it 3 times a day for the days that you have your period, for up to 5 days.
Okay.
And it reduces your blood loss with your periods by about 50% on average.
Right.
So that's a great medication. Again, you have to be the right candidate. If you have certain medical problems, it's not great for you because it could potentially increase your clotting.
Yes.
But I have many patients on that, and they're very happy because their blood loss is greatly diminished. So that's something you could take to treat your bleeding issue, but also allow you to get pregnant if you're actively trying to get pregnant.
Yes, yes. Can we please turn up our volume? Oh, is it hard to hear? I'm so sorry. Let's see. Is that a little bit better? See if that's better. Sorry if it was hard to hear. It's hard to tell on this side of things. So hopefully you were able to hear what Dr. Denoble was sharing. So we were just talking about getting pregnant. Now, is there anything else that we've left out? I know that we talked about different ways that you can help the bleeding.
Yes.
And do we go over all of the tests that can be done? I know.
Yeah. So again, you know, you initially want to have a sonogram if you're having bleeding concerns. Usually sonogram and blood work.
Sonogram and blood work. And where exactly do you do that?
Sonogram, many doctors do them in their office. We do that here in our office. If your doctor does not provide it in the office, and your radiologist, you just get a prescription for vaginal sonogram. It is done transvaginally and transabdominally. Okay. So I would do an ultrasound to just look at the uterus, the overall shape, the lining. Sometimes a procedure is required called a saline sonogram that will better evaluate the cavity. Regular ultrasound sometimes can't see the cavity very well, and if there's something potentially there, but you don't want to go for surgery for the scope, a saline sonogram is done in the office. We do provide that here, where a catheter is introduced to inject some saline, and then the ultrasound is done, because the saline will fill up the cavity and it will outline any abnormalities like fibroids or polyps or areas of thickening. I would do that in blood work. Aside from the hormones we mentioned, you do definitely want to check your thyroid. Thyroid irregularities or problems can cause period problems.
Oh, interesting.
So that's another thing, you know, if a patient comes to me, their periods are changing, they're irregular, want to make sure the thyroid level is normal.
And is that something you can do, or do they have to?
I do. Send them for a thyroid check. And also another hormone called prolactin, which can be elevated. Usually it's elevated when you're pregnant. Yes. Prolactin, lactate. And that does lead to absence of periods or irregular periods. So you want to rule that out. But when you're not pregnant or nursing, it can also be elevated due to some tumors that can release the hormone called prolactin. So you want to evaluate that. If it's elevated, you may need an MRI of your brain.
Oh my
Sounds
goodness.
scary, but it is not a cancer, but it is, if there's a tumor there, you can shrink it with medication. Or sometimes you may need surgery through your nose to remove the
My goodness,
The
so
tumor.
many things.
There are many different things.
Yes,
So you always want to
yes.
rule everything out. So blood work is great. You want
Blood
to make
work,
sure you're not
yes.
anemic. You
Uh-huh.
want to make sure that the bleeding irregularities, or if they're heavy, is not causing anemia, which should be treated.
Mhm.
I've had patients come in and they just don't look great. They don't feel great. Their
Mhm.
energy level is not high. They're just assuming it's perimenopause.
Yes.
But it's anemia from their blood loss.
Yes.
And iron and treating the bleeding so you don't get so anemic is obviously crucial.
Right.
So blood work and ultrasound are the initial tests we do.
So
And
just
then you go from there.
you really need to listen to your body.
Yes.
Like if something is going on, then
Absolutely.
yeah. So
Can you hear us now? Okay.
is that?
That is my mother. Hi, Mom.
That's what I thought. So you're having trouble hearing us right now? That's oh, darn it. My microphone is right here, so I'm sorry if you're having any
Blinking.
issues. I know it's blinking. Look, it sees me. It hears me.
Okay, good.
So anyway, so we have discussed so much,
Yeah.
and please reach out to Dr. Denoble or your doctor if any of these things are going on.
Yeah.
Dr. Denoble is here in Ridgewood, right across from the train station, right by Whole Foods, and in Wesley Square. Is that what it is?
Wilsey Square.
Wellesley Square.
It's right next to Carlos Bakery. Everyone knows Carlos Bakery.
Okay, Carlos Bakery.
So if you know
Okay.
Carlos Bakery, the cake boss shop, we're a couple doors from there.
Okay.
But again, the main thing I want to just get across to everyone, if you're suffering especially from bleeding issues, it can be treated. And a lot of the treatments can be very simple with low risk and performed easily.
Mm-hmm.
I have patients come in and they're just bleeding half the month. And they're anemic, like I mentioned, and they're tired from the anemia.
Right.
So you don't have to suffer through that. It can be treated in many ways.
That's wonderful.
You know,
and I was talking with someone yesterday. I just want to go back to the surgery and the polyps and all, because I know people are fearful of surgery.
Yes, yes.
And that's not what they want to jump right into.
Of course.
But you are saying that it should be done.
Well, if you do have a polyp, or if the lining appears abnormally thickened, you will need the polyp removed or a scraping, a DNC, to remove the tissue, one, to stop the bleeding, and also to send to a pathologist to rule out anything. And these surgeries can be done under light sedation with local. You don't have to be put completely under.
Yes.
If that's what people are fearful of. And they're low risk surgeries and they're outpatient. The procedures take 30 minutes, 45 minutes long. And you go home the same day, and there's very minimal downtime after that.
Okay.
So don't shy away from it if you absolutely need it. You don't always need surgery. Many times you don't need a surgical procedure.
Yes.
But if there is an abnormality, we do recommend taking care of that. Usually.
And what's the recovery on that?
For the DNC hysteroscopy procedure, removal of polyps, like I mentioned, you go home the same day. You don't have to spend the night in the hospital. You're there about an hour or two.
Okay.
And you may have some minor cramping, some light bleeding for a few days afterwards. But you can go to work the next day.
And it's normal also if you have polyps
Yes.
that you could have the irregular bleeding, heavy bleeding.
Yes, absolutely.
But then it goes back to normal, right?
Yes, if that is the cause, it does resolve. Absolutely. Absolutely. Sometimes we do, two things at one time. I've had patients where we remove the polyp, do a scraping, and then put in the Mirena IUD. Well, at the same time. They say, I want the IUD for the next 5 years to treat my bleeding issues and get me into menopause. So sometimes we do that.
Just to share with you guys, and I've also spoken with some other women, so this is why I'm going to have full disclosure here. I myself, you have found polyps, and I myself need that surgery. And the reason you did the test was because I had very heavy bleeding, to a point where it was almost, I couldn't leave the house. It was so bad. Because I wasn't sure how much blood. But I don't deal with that every month. Like it's been a couple of times. And now I'm okay. But I'm sure it'll happen again at some point. And I know that I need to go in for the surgery. So I'm just saying that if you have the heavy bleeding, and then all of a sudden a few months or several months you don't have the bleeding,
right,
there's still something going on, because it's not normal for you to have all of a sudden very heavy bleeding.
Right. And again, my main concern as a physician is to make sure there isn't anything malignant or pre-malignant. You know, that's my, I like to check that off the list.
Yes.
Because God forbid there is something, you know, we want to catch it early and take care of it.
Right.
So that is a big concern. You know, if your bleeding go back to normal, you can get a repeat ultrasound and check. Make sure there's still something there before rushing to surgery.
Okay.
You know, so if your bleeding patterns become more normal again, then you can get a repeat ultrasound and take a look again.
Okay.
To avoid that. Or just do the saline sonogram, as I mentioned, which even looks a little bit better.
Right.
And you may avoid surgery.
Okay. Now, please, if you have any questions, please don't hesitate to ask right now live. But also, Dr. Denoble is going to be coming on once a month, and she will be sharing with us different topics based on your questions. So the heavy bleeding was something that was asked by one of your patients, and which is why we have been focusing on this. So
I have had requests that I will talk about this in future sessions, in future interviews, about PCOS, which many women have heard of and they may be suffering from, or their children.
Can you tell us what that is?
It stands for polycystic ovarian syndrome.
Okay.
It does not mean you have large cysts on your ovaries. It's a syndrome where typically you do not get regular periods. You may only get a few a year. When you do get them, they tend to be heavy. And you might have other symptoms, a lot of acne, and a lot of hair growth.
Yes.
So it's a syndrome that encompasses, it's a hormone imbalance where you're not ovulating regularly. Women who are trying to get pregnant need to get this addressed because it can prevent pregnancy. Okay. If you're only ovulating 3 times out of the whole year, then your chance of getting pregnant is a lot lower.
Absolutely.
You may be pre-diabetic. That goes along with it as well. So there's a lot of other hormonal issues that can go along with it. Okay. So we will talk about that in the future. We can talk about endometriosis, which is a common condition that can cause a lot of pain in women. Yeah. And unfortunately, many young girls and women suffer from it, and their doctors sometimes treat them as if they're just drug seeking, looking for pain medication, or sometimes they're looked at as if it's in their head. Yeah. But it really causes debilitating pain. It can affect their relationships, their daily life.
Is that pain when they have sex?
It can be, but typically it's pain right before or during your period.
Oh, I see. Okay.
But it can cause chronic pelvic pain. So we'll touch on that as well and go into endometriosis. But that is something that many women suffer from. There are a lot of now celebrities who are speaking out about it to increase awareness. Yeah. I know Lena Dunham, I believe, spoke about it. Okay. And that woman who's a chef, I forget her name, but she speaks a lot about it as well. Okay, all right. So we will touch on endometriosis as well. Endometriosis, PCOS. And then please let us know what other topics are interesting to you.
So if there is something that's going on and you would like us to talk about it, or Dr. Denoble talk about it, I'm just here, facilitator. But can you give them your email? Not your email, I suppose your website.
Yes, so our website is www.advancedgynj.com. You can look on there. There is an email, or the email is info@advancedgynj.com. If you just Google my name as well, it should come up.
You can put in Dr. Shagha Denoble, Dr. Denoble, gynecologist in Ridgewood, anything, that'll come up.
Or on the Facebook page, you can send a message as well, and I will keep track of the questions and be sure we address the topics that you're most interested in hearing about.
That's wonderful. Thank you so much for being on Coffee with Marci and sharing all of this information. I mean, it's just invaluable what you've shared today.
And thank you for providing this amazing forum for all of us to hear about so many things.
Of course, stylists
and dermatologists.
I'm having a lot of fun, and let me tell you, I've just been enjoying interviewing people like you and bringing information to the viewers. So, and one of the things I also want to know, is there someone that you'd like me to have on? Is there something that you want to know about? Is there a business that maybe you drive by all the time and you don't know anything about it? I want to find out for you, okay? I want to bring that information to you. So thank you so much for tuning in, and we will see you next time on Coffee with Marci, okay? Have a great one. Bye.
Bye.